Many times we get sent a photo and asked if it is benign or whether it can identify it or whether it can be removed. In reality, it is more complicated than that. Many times we get sent a photo and asked if it is benign or whether it can identify it or whether it can be removed. History is as important as examination itself. There are 4 key questions one should ask. 1 is the duration. How long has it been there? 2, has there been any changes? Has it grown? Has it changed in color, shape, or thickness? And 3, are there any symptoms such as pain, itch, bleeding, ulceration, or recurrent scabbing? And 4, past history, whether the patient has had skin cancers in the past and family history of melanoma. The less important question is a risk factor, whether the patient exposed to sunlight, tanning beds, or on immunosuppressive therapy. A stable lesion present for many years without symptoms is usually benign, and any rapid change or new onset in adulthood should raise concern. Common facial lesions that we get presented with are seborrheic keratosis, solar lentiginous sunspots, cherry angiomas, dermatosis papulosa nigra, milia, and skin tag. It is important to learn to make the correct identification and diagnosis using a dermatoscope. As mentioned, after history, then there's examination. We look for A, B, C, D, and E. A, if there's any asymmetry. B, are there any border changes, irregularity, notch, or poorly defined? C, whether there are multiple colors, such as brown, black, red, white, or blue. This indicates changes. D, if any lesion is more than 6 millimeters, one need to be concerned. And C, whether there's any change in size, shape, or symptoms as mentioned in the history. Other warning signs include new pigmented lesions in adulthood, or a non-healing ulcer, especially with a pearl road age, consider basal cell carcinoma, or a firm rapidly enlarging nodule, consider squamous cell carcinoma, persistent bleeding, crusting, or pain. These are the pros for trainees or someone wanting to remove skin lesions. Always examine with the dermatoscopy. Document findings with photos and measurements for follow-up. And if in doubt, refer or biopsy. Never reassure without certainty. Patients appreciate clear explanation. Distinguish common benign lesions from warning signs so they understand the reasoning. And for those who are seeing these common lesions or seeing clients that request removal of lesions, we have an online training available. And as always, having a dermatoscope and training is essential. Thank you for watching. I appreciate your subscription, share, and comment. Thank you for watching.